Okay, let's unpack this. Have you ever noticed your cat maybe starting to behave a little differently? Maybe they're drinking a bit more water or suddenly losing weight even though they're eating like a champ. It's kind of fascinating how these subtle changes can hint at something much deeper going on inside. So today we're taking a deep dive into the complex world of feline endocrinology. We've gathered some pretty comprehensive sources on cat hormones and their imbalances basically, what keeps a cat's body running smoothly. And our mission here is to pull out the most important nuggets for you, our listener. Think of it as a crucial shortcut to understanding two really common and significant feline health challenges: hyperthyroidism and diabetes mellitus.
Yeah, and what's so truly fascinating, I think, is just how powerful these tiny glands are. They really do orchestrate a cat's entire body, everything from metabolism right down to mood. Understanding this system is it's absolutely foundational to feline health. In essence, the endocrine system is this really sophisticated network of glands. They secrete hormones.
Yeah.
And these are vital chemical messengers regulating, well, everything from growth to blood pressure, basically working to maintain that overall balance, what we call homeostasis. And the key thing to remember, I think, is how interconnected it all is. A problem in one gland, a primary issue, can often lead to this whole cascade of secondary problems elsewhere,
Yeah.
which is why, a holistic perspective in vet care is just so essential.
Right. So to really get a handle on how things can go wrong, we first need to meet the main players in your cat's endocrine system. You can think of it almost like an internal orchestra, right? And each gland has a very specific instrument it plays. Oh, first step. Right there at the base of the brain is the pituitary gland. This one's really the master conductor because it influences so many other things: growth, milk production, even water balance. And it also sends signals out to other key glands like the thyroid and the adrenals.
It's quite remarkable, isn't it? I mean, even conditions like excessive growth hormone, which can lead to acromegaly, or, say, too much ACTH causing Cushing's disease, a lot of that can trace right back to this tiny master gland. It really does set the tone for the whole system.
Absolutely. And moving down into the neck area, we find the thyroid gland. This is your cat's metabolism regulator. It turns out hormones T4 and T3, and these influence nearly every single cell process in the body. And right nearby, there are these four tiny parathyroid glands. These are the calcium balancers. They secrete parathyroid hormone, PTH, to keep those blood calcium levels just right, which is crucial.
Oh, absolutely crucial. You can appreciate why maintaining calcium is so vital, right? I mean, it
Yeah.
affects everything from nerve function to muscle contraction. Any imbalance there, well, it can have immediate, very noticeable effects.
Exactly. Then sitting sort of on top of the kidneys, you've got the adrenal glands. These are your cat's main stress responders.
Yeah.
They pump out hormones like aldosterone for blood pressure, cortisol for metabolism and immune function. And of course, epinephrine and norepinephrine, that's your classic fight or flight response chemicals you often hear about. Common adrenal issues like Cushing's, too much cortisol, or Addison's, which is not enough. And finally, near the liver and stomach, we have the endocrine part of the pancreas. This is the blood sugar guardian. That's where insulin and glucagon are made, working together to keep blood sugar stable. And naturally, the gonads, ovaries in females, tests in males, they're the reproductive architects, producing those sex hormones essential for development and reproduction.
So if we kind of connect all this back to the bigger picture, you can clearly see why any little deviation in this system, whether it's too much of a hormone or not enough, it can just trigger this cascade of problems throughout the body. It really is a delicate dance. And even small missteps can have these profound, really widespread effects on your cat's health.
Okay, now here's where it gets really interesting, I think, especially if you have older cats at home. Feline hyperthyroidism. It is incredibly common, particularly in, our senior feline friends. You might think of it like their internal engine is suddenly stuck in overdrive. Essentially, it's just an excessive production of those thyroid hormones, T3 and T4, usually coming from an enlarged thyroid gland.
Yeah, and this often brings up the question, well, what exactly causes it? In the vast majority of cases, we're talking 96 to 98%. It's actually a benign overgrowth of the thyroid tissue. Think of it like a non-cancerous goiter. But what's truly fascinating are the potential contributing factors that seem to go beyond just age, which, by the way, the average age of diagnosis is around 13 years. We do see it less in certain purebreds like Siamese and Himalayans. But what's really getting attention now are things like environmental exposures, certain pollutants found in some cat litters, specific pesticides, even flame retardant chemicals. These have all been looked at.
Wow, that's surprising. So it's not just about them getting older. What about diet? I feel like I've heard some talk about that.
Oh, definitely. Dietary habits are certainly drawing attention. There's been an observed link with canned food, especially the fish-based kinds, showing maybe a 2 to 3 times increased likelihood. Now, this has led to some speculation about bisphenol A, BPA, that lining in aluminum cans. But it's really important to note, about a quarter of cats affected never ate canned food at all. And even just an indoor lifestyle has shown some correlation. So for you, the key takeaway here is really this multifactorial nature. It's complex. And that's crucial because it informs that proactive vet care, right? It's not just about treating the disease once it's there. Understanding these broader influences might potentially help in preventing it down the line.
Right, right. So, okay, if your cat's internal engine is in overdrive, what does that actually look like for you, the owner? The hallmark sign, the one that should immediately make you go, is significant weight loss. But, and this is the key part, despite your cat having an excellent or even increased appetite, they're eating sometimes like crazy, but they're still wasting away. That's a huge red flag.
And that's often what brings people into the vet. Beyond that, you might also notice increased thirst, we call that polydipsia, and increased urination, polyuria. Cats might seem restless or hyperactive. Maybe they start yowling or vocalizing more than usual. Some develop chronic vomiting or diarrhea. Their coat might look kind of messy or unkempt. Or they could even start urinating outside the litter box inappropriately.
And what would a vet typically find during an exam?
Well, on the physical exam, we often pick up an increased heart rate. And very frequently, we can actually feel an enlarged thyroid gland, like a little lump, in their neck. And it's really important for you to know that beyond these outward signs, hyperthyroidism can lead to some pretty serious internal complications. Cardiovascular issues are common. Things like hypertrophic cardiomyopathy, that's where the heart muscle thickens, and systemic hypertension, which is high blood pressure. And these can unfortunately lead to serious outcomes like heart failure or sudden blindness, often from the retina detaching, or even in some cases, sudden death.
Wow.
So the diagnostic journey, it usually starts with that clinical suspicion based on the science we just talked about. Now, while a markedly high total T4 hormone level is often definitive, what's really crucial for you to understand is that borderline T4 results, they're surprisingly common. This happens because, well, normal daily fluctuations can occur. And sometimes, if your cat is sick with something else, what vets call euthyroid sick syndrome, that other illness can actually push the T4 levels down, making them look normal when they're actually not.
Huh. That sounds tricky then. So how do vets actually confirm it if that single T4 test isn't always reliable?
Exactly. Yeah, it can be tricky. That's why we often rely on specific confirmatory tests. One is called the T3 suppression test. Think of it like this. In a healthy cat, if we give them a little bit of external T3 hormone, their own thyroid gland should naturally slow down making T4. But in a hyperthyroid cat, their thyroid tissue is kind of running rogue. It's autonomous. It won't listen to that signal, so the T4 levels won't drop, they won't suppress. Another really valuable test is equilibrium dialysis-free, T4, or FT4ED for short. This measures the biologically active form of T4 and is generally less affected by those other illnesses we mentioned. But really, for the definitive diagnosis, especially to figure out the exact location, size, and how active the tissue is, or to detect those rare malignant tumors, a nuclear medicine scan, often called a per-technetate scan, is truly the gold standard. It gives us the clearest picture.
Got it. So once you have that diagnosis, you'll find there are several paths forward for treatment. And each one comes with its own set of, practical things to think about, pros and cons you should be aware of. First up, there's medical management, usually using a drug called methimazole.
Yes, methimazole works by basically blocking the production of new thyroid hormones. It's readily available. Generally, the short-term cost is lower. It's effective for most cats. And importantly, it's reversible. If you stop the medication, the effects wear off. Plus, no hospitalization needed initially.
Okay, that sounds pretty straightforward. Is there a catch? What's the downside?
Well, yeah, there are downsides. It requires lifelong daily administration, usually pills or sometimes a transdermal gel, which can be a commitment for owners. And importantly, it doesn't actually cure the underlying problem. The thyroid mass itself can keep growing or even rarely transform over time. Some cats do experience side effects, things like lethargy, vomiting, sometimes facial itching, or even less commonly, changes affecting their liver or bone marrow counts. And here's a really critical point for owners to understand. Methimazole can sometimes unmask underlying kidney disease. See, hyperthyroidism can artificially boost blood flow to the kidneys. So when you treat it and that blood flow normalizes, kidney issues that were sort of hidden before might suddenly become apparent. That requires careful monitoring.
Wow, okay, that is a crucial detail. What about radioactive iodine therapy, or I-131? I've heard people call that the gold standard.
It absolutely is considered the gold standard, and for good reason. It's typically a one-time curative treatment for the vast majority of cats. We're talking 96 to 98% effective. It's non-invasive, just involves a single injection, and it doesn't require general anesthesia, which is a plus for older cats. And that initial scan we talked about can also help flag if the overactive tissue might be malignant, which is rare, but good to know.
So what are the drawbacks then? Why doesn't everyone just do that?
Well, the main drawbacks are logistical and financial, mostly. It requires temporary hospitalization in a specialized facility, usually for about 3 to 4 days, because the cat is radioactive during that time. Then after they come home, there's usually about a week and a half of restricted activity, handling precautions to minimize radiation exposure. Finding these specialized facilities might be tricky depending on where you live, and yes, it is relatively expensive upfront compared to starting medication. There's also a small risk of causing hypothyroidism, meaning too little thyroid hormone afterwards, or potentially worsening kidney function, similar to methimazole. But for many, the benefit of a one-time cure outweighs these factors.
Okay, and then there's surgical thyroidectomy, which is just physically removing the abnormal gland tissue.
Yes, exactly. That can offer a permanent cure if it's successful. It's often more accessible geographically than I-131 in some areas. And if only one thyroid lobe is affected and needs removal, the risk of a serious calcium complication is much lower. However, it does require general anesthesia, which always carries some risk, especially for older cats or those with heart conditions. And there's always a risk of not getting all the abnormal tissue, leading to recurrence later.
Are there other specific risks with the surgery itself?
Oh, definitely. There are some significant potential risks. Damage to the laryngeal nerve nearby can affect your cat's meow, change their voice. Damage to the sympathetic trunk can lead to something called Horner's syndrome, which affects the eye and eyelid on that side. But probably the most significant acute risk is a calcium crisis, or hypocalcemia. This happens if those tiny parathyroid glands, which control calcium, are accidentally damaged or removed during the surgery. This can lead to really severe signs like anxiety, muscle twitching, seizures, even dangerous heart rhythm problems. It's a major concern. And there's also a rare but very serious possibility of a thyroid storm. That's an acute, massive release of hormones triggered by the stress of surgery or anesthesia.
Yikes. Okay, that sounds quite serious indeed. And finally, you mentioned dietary therapy, using a special iodine-restricted diet.
Right, this is a non-invasive approach. The idea is to severely limit the iodine your cat eats, because iodine is essential for making thyroid hormones. So, no daily meds, which is appealing for some owners. But the trade-off, and it's a big one, is it demands absolutely strict compliance from you, the owner. That means literally no treats, no table scraps, no access to any other food source at all. This makes it pretty impractical for cats that go outdoors, or if you have multiple cats in the house where you can't strictly control who eats what. It's also slower to take effect, sometimes taking up to 12 weeks to see results. And unfortunately, it just doesn't work for about 10% of cats.
Okay, so when you sum all that up, what's the general prognosis for cats with hyperthyroidism?
The good news is with the right treatment choice for the individual cat and owner, and with diligent monitoring, many, many hyperthyroid cats can achieve an excellent quality of life for years. The key is really finding the treatment that fits your situation and your cat best, and understanding that all these options require an ongoing commitment to their care and monitoring.
Okay, great. Now, let's pivot a bit and talk about another incredibly prevalent endocrine condition in cats. Diabetes mellitus. I think many of us are probably familiar with human diabetes, and, while there are definitely similarities, cats certainly have their own unique aspects to it. So what's the biggest underlying cause, the biggest risk factor that we really need to be aware of?
Okay, if we connect this to the bigger picture for you, the single most significant risk factor, by far, is obesity. Being overweight increases a cat's likelihood of developing diabetes by up to 4 times. 4 times. And sadly, this is directly tied to the epidemic of overweight cats we're seeing these days. Other factors definitely play a role too. Increasing age, diagnosis is often between 7 and 10 years old. Physical inactivity, being male, seems to increase risk slightly, and also prolonged administration of steroid medications. But that obesity link really highlights a critical area for proactive owner education. Weight management and encouraging physical activity are just so vital, not just for preventing diabetes, but for their overall long-term health too.
Right. You often hear about the P's of diabetes, and recognizing these can genuinely be life-saving for your cat. So first, there's polydipsia. That just means increased thirst. What happens is when the blood glucose gets really high, it overwhelms the kidneys. Glucose starts spilling into the urine and sugar pulls water with it, right? So that causes dehydration and makes the cat intensely thirsty.
Exactly. And that leads directly to the next P, which is polyuria, or increased urination. It's simply because of all that extra water being pulled into the urine by the glucose. Your cat is drinking more and urinating more.
Makes sense. Then there's polyphagia, which means increased appetite. And this is a really counterintuitive one, I think. Despite eating more, sometimes ravenously, cats with diabetes often lose weight. That's because their cells can't actually get the glucose fuel they need. It's like they're starving on a cellular level. So the body starts breaking down its own fats and proteins for energy instead. So just like with hyperthyroidism, seeing weight loss despite a good or even increased appetite should be a serious warning sign.
Absolutely. And beyond those classic Ps, you might also notice your cat seems lethargic or weak. Their coat quality might decline, look dull or greasy. And they might get chronic or recurrent infections, especially urinary tract infections, because all that sugar in the urine creates a perfect breeding ground for bacteria. In rare, usually more advanced cases, we might also see something called a plantigrade stance. That's where the cat starts walking with their hocks, basically their ankles flat on the ground, due to nerve damage from the high glucose. The good news is this nerve damage often resolves once the diabetes is well controlled with treatment.
Okay, so if I'm seeing these signs, how does a vet definitively diagnose diabetes? I imagine, like you said with the T4, a single high blood sugar reading isn't enough, especially with how stressed cats get at the vet.
You are absolutely right. Diagnosing diabetes definitively requires showing persistently high blood glucose and the presence of glucose in the urine, glucosuria. And for you as an owner, it's vital to know that a single high blood glucose reading in a stressed cat at the vet clinic is not enough for diagnosis. This stress hyperglycemia is a huge thing in cats. Their blood sugar can shoot up dramatically just from the car ride and the clinic environment. This is where the serum fructosamine test becomes incredibly valuable. It gives us a reliable average of your cat's blood glucose levels over the previous 1 to 2 weeks, kind of like an HbA1c test in humans. And crucially, it is not affected by that short-term stress spike. Of course, we also want to run other tests to rule out any concurrent conditions that might be contributing or complicating things, like UTIs, kidney disease, pancreatitis, or even hyperthyroidism happening at the same time.
Okay, gotcha. So for most cats, diabetes is a lifelong condition, needs ongoing care, but successful management definitely means a good quality of life is possible. The cornerstone of treatment for, well, for the vast majority of diabetic cats is insulin therapy. This usually involves an injection given just under the skin subcutaneously, typically every 12 hours.
Right. And there are various types of insulin available that vets use in cats. Your vet will choose the best one for your specific cat. Things like Prozinc or Glargine or Datamir are common choices.
Now, here's an incredibly important safety point. This is something you will absolutely want to be meticulous about. It is critical, absolutely critical, to match the correct syringe size they come in U100 or U40 concentrations to the specific type of insulin your vet prescribes. Using the wrong syringe can lead to massive overdoses or underdoses, which can be incredibly dangerous, even fatal for your cat. So this is a key safety protocol you need to double check every single time. The good news is owners can be trained quite easily to give these injections, and honestly, cats usually tolerate them remarkably well.
And alongside insulin, dietary management is absolutely crucial. It's a cornerstone, too. We generally recommend a diet that's low in carbohydrates and high in protein. Wet food formulations often fit this bill really well and have other benefits for cats, too. And for those diabetic cats that are also obese, a supervised weight loss plan is a really key part of the treatment strategy. Typically, we recommend feeding meals right before the insulin injection is due.
And speaking of advancements, this is actually pretty new and exciting. In 2023, oral medications called SGLT2 inhibitors were approved for managing diabetes in some cats. These are fantastic because they are once-a-day oral meds, no injections.
Yes, it's a really interesting development. Their mechanism is quite clever. They basically work by increasing the amount of glucose that gets excreted out through the kidneys into the urine, which helps lower blood sugar levels. They also seem to improve insulin resistance and might even help protect or repair some of the insulin-producing cells in the pancreas. Now, these are generally suitable for newly diagnosed, otherwise healthy cats who are confirmed to still be producing some of their own insulin. They're not for every diabetic cat, but in the right candidates, they've shown really good effectiveness, over 80% in some studies.
That's great news. So, as an owner, managing this means your role in home monitoring is really, really important, right? Paramount. You'll want to keep really good records tracking things like your cat's water intake, how much they're urinating, their appetite, their weight, and of course, the timing and amount of their medication.
Exactly. And for monitoring the blood glucose itself, the gold standard is performing blood glucose curves at home. This usually involves checking their glucose level right before their insulin shot, and then checking it again every, say, 1 to 4 hours throughout the day, depending on your vet's recommendation. The beauty of this is you can learn to do it at home, usually by getting just a tiny drop of blood from the edge of your cat's ear vein. It's much less stressful for them than being at the vet. And doing it at home minimizes that stress hyperglycemia we talked about, so you get much more accurate results to guide treatment adjustments. For those looking for even more data, there's also continuous glucose monitoring, or CGM. This involves a small sensor placed under the skin that gives continuous glucose readings for several days or even weeks.
Wow. Okay. And we really need to reiterate a critical rule here. As an owner, you should never, ever adjust your cat's insulin dose on your own without direct consultation and specific guidance from your veterinarian. This is absolutely for your cat's safety. Dosing needs expert assessment.
Absolutely critical. While management is usually very successful, it is vital to be aware of two potentially life-threatening complications. The first and most immediately serious is hypoglycemia, that's dangerously low blood sugar. Signs can include weakness, severe lethargy, vomiting, lack of coordination like being drunk, muscle tremors, seizures, and eventually coma. If you ever see signs like these, immediate action is needed. First, offer their regular food. If your cat is unwilling or unable to eat, you need to immediately get some sugar into them. Rubbing an oral glucose source like honey, corn syrup, or maple syrup directly onto their gums is the safest way. And then you must seek immediate veterinary care. It's an emergency. And a crucial safety note here. Never try to force liquids or food into the mouth of a cat that is having a seizure or is unconscious, because they could breathe it in, aspirate it, which is incredibly dangerous. Just rub the syrup on the gums.
Okay, that is incredibly important information to remember. What's the other major complication?
The other really serious complication is diabetic ketoacidosis, or DKA. This is a severe, life-threatening condition that happens when the body, starved for glucose energy, starts breaking down fats at a very rapid rate. This produces acidic byproducts called ketones, which build up in the blood, making it dangerously acidic. DKA is an absolute medical emergency that requires immediate hospitalization, intensive care with IV fluids, insulin therapy, and very careful management of electrolytes.
Okay, so that sounds like a lot to manage, potentially quite scary. But is there any hopeful news, anything unique about feline diabetes?
There absolutely is, and this is something truly unique and really encouraging about feline diabetes, the potential for remission. Yes, remission. With early diagnosis and aggressive, appropriate treatment, particularly using certain types of insulin like glargine, combined with strict low-carb dietary management and close monitoring, some cats can actually achieve normal blood sugar levels, to the point where they no longer require insulin injections at all. Factors that seem to increase the likelihood of remission include being older at diagnosis, having a history of prior steroid use, which might have triggered the diabetes, and as I said, treatment with glargine insulin. But really, the most significant factors seem to be starting insulin therapy very early after diagnosis and maintaining excellent, consistent glucose control through monitoring. Now, if remission isn't achieved within about 6 months or so, lifelong insulin therapy is probably likely. But even for cats that go into remission, they still need to stay on that strict low-carb diet and have ongoing monitoring, because they can certainly relapse later on. So, if we connect all this back to the bigger picture again, you can really see that being proficient in feline endocrinology, both for the veterinarian and for you as an informed owner. It really extends far beyond just memorizing facts and symptoms. It truly demands an appreciation for these deeply interconnected body systems, really careful interpretation of often subtle signs, and frankly, a deep, ongoing commitment to your cat's long-term health and well-being.
Yeah, absolutely. So, what does this all mean for you listening today? You've just gained, hopefully, a crucial understanding of two of the most common and really impactful endocrine conditions we see in cats. You now know more about what signs to look for, you understand a bit more about the complexity of diagnosis, and you're aware of the incredible array of treatment options that are available now. So here's maybe a final provocative thought for you to consider. Given what we know about the rising rates of feline obesity and that really clear, strong link to diabetes, What proactive, maybe even small everyday changes could you potentially make in your own cat's life starting right now? That might just prevent them from ever needing us to deep dive into this particular topic specifically for them. Something to think about.